Hey everybody, my name is Maxillofaical. I went to Harvard Dental School and I'm currently a fourth year oral maxillofacial surgery resident at Parkland Hospital. I'd like to go over a few things that I wish I knew when I started dental school or before applying to residency. And this is probably going to be more applicable for people applying to oral maxillofacial surgery. First thing I'd like to go over is the didactic scores. I went to a dental school with pass-fail with no class GPA or ranking, but they're extremely important because it's one of the very few ways where programs can objectively evaluate you. If you're in a pass-fail school like I was, then your CBSE score becomes very important. Uh, I recommend aiming for a score above 70. I think any score above 70 is very competitive to get you into any residency. Now, that doesn't mean if you score below 70, you won't match. But I would make 70 my goal score, and at the same time, try not to sacrifice any extracurricular activities, externship performances, and research for your CBSE. Remember, you want to have a balanced application. Second thing I would like to talk about is letters of recommendation. In my opinion, any time between third year of dental school before third year of dental school is a good time to find a research mentor in the field you're going into. And that's the best opportunity, in my opinion, to get a good personal letter of recommendation. Now, if you're not really interested into research, it doesn't have to be a groundbreaking project. It's just a venue for you to show some initiation and motivation, make a relationship with the person who will write you a good letter of recommendation, and it's a great positive on your application and interview trail. It was talked about during every single one of my interviews. I don't think it's a must have, but I think it's a perfect opportunity to establish a relationship with a mentor and for future letter of recommendation. It's a very positive component of your application, and it's a great topic to talk about during your interviews. Third thing I want to talk about are externships. So if you're applying to oral maxillofacial surgery, externships are very important. But you need to know that externships can hurt you as much as they can help you. So take them very seriously. When you're on externship, no one is trying to see how much you know or how well you can extract a tooth. That's something you're going to learn throughout residency. And programs don't care about that. There's two things that everybody looks for in an intern. First thing is your attitude, and second is if you're a hard worker. These two are the most important characteristics every oral maxillofacial surgery program looks for, in my opinion. So be ready to showcase that about yourself. Go to externship with a good, positive attitude and work hard. And remember, externships can actually hurt your chances. So put as much as you can into them. Finally, I'd like to talk about interviews. There's a few things that you need to know. If you've done research and you have put that on your application, know your research topic inside out because you will have to talk about it at some point. I think personal statements are a great foundation of what you can talk about during interviews. In my case, in my personal statement, I told the programs why I want to do oral maxillofacial surgery by telling them a story of my life. And that dictated how all my interviews went. Every interview, I wanted to know more about my life story. So give them a topic to ask about during the personal interview. And again, remember, the most important qualities oral maxillofacial surgery programs look for is first, if you have a good attitude and if you have a good work ethic. And are you a team member? If you have an extern at the program that you're interviewing at, the interview is the best place to showcase those two qualities. I hope this was helpful and good luck on applying to residency. Thank you.